Welcome to the Physician Associate Podcast.
Hello and welcome to this episode of the Physician Associate Podcast. My name is James. Today, I'm delighted to be joined by two colleagues from Ireland to discuss physician associates in their country. Firstly, Sean Robinson, the Director of Education for the RSCI PA programme, and also Aoife Sartini-Bhreathnach, who is the President-elect of the Irish Society of Physician Associates. Welcome to the show, both.
Thank you. It's great to be here.
Thank you for having us.
Aoife, Sean, could I ask you both to just introduce yourselves and explain your history as physician associates?
So I'm Aoife. I've been working as a PA since I graduated in 2019. Once I graduated, I began working as a surgical physician associate in the Mater Hospital, and I've stayed in the same job since. I love it. My consultants are fantastic, and I get an opportunity to be involved clinically with patients surgically and also in research. So I've got the best of both worlds there. And I am also President-elect of the Irish Society of Physician Associates, and I'm a committee member of the Advocacy Committee, which has been newly formed.
And my name is Sean Robinson. I'm the Director of PA Education, or Director of Education at RCSI, as you mentioned before, here in Dublin. And I've been doing that for the last year and a half. And I came in under the program director, who is Lisa Alexander, who I know from George Washington University for the PA program there. I used to work for that institution prior to coming to RCSI in their PA program. And then prior to that, I was at a PA program in Massachusetts. So I've been a PA for just about 20 years. And my clinical background would be in cardiology, interventional cardiology, and urgent care. But at this point, I've spent really almost the bulk of the last 10 years or more in PA education. So that really is my first calling at this point, more so than the clinical aspects. I think I put a lot of importance on advocacy for the PA profession. And so sort of like what Aoife is doing here for the ISPA, I've done in various groups in the US with the American Academy of PAs, working a lot on their House of Delegates for a number of years, which is sort of crafting policy for that organization. And then for the Massachusetts Association of Physician Assistants and the Virginia Academy of PAs, I've been doing that for a number of years until moving to Ireland.
Wow, brilliant. Thank you so much for joining me on the podcast. I am a physician associate. I've been qualified 4 years or so, but I've always worked in the NHS in England. And Ireland isn't all that far away, but I profess to being quite ignorant about the Irish healthcare system and the differences between the two countries. So could you start by just explaining what healthcare is like, how it's similar perhaps, and any differences between the UK and Ireland?
Okay, well, in Ireland, similar to the UK, we have the HSE, which is similar to NHS, and that we have our public sector in terms of healthcare, and we also have private sector. In terms of the public, run by the HSE, we now have physician associates working all within the medical model. And of course, we have our nursing side and so on. But in terms of the medical model, that's the unit that we have in force at the moment, and the physician associate be the latest role working within the HSE. In terms of our physician associates that have graduated, most of us would work within the public sector. However, there have been a number of jobs that have come available in the private sector. Similarities and differences, I'm sure the private sector in the UK would be similar to our private sector here, and PAs have been able to work similarly between the both.
Thank you, Aoife. Sean, could I just do some quick rapid jargon busting with you? Could you just tell me HSE, what does that stand for?
The Health Service Executive, which would be the sort of equivalent, as Aoife had said, to the NHS.
Perfect, thank you. And the ISPA?
That's the Irish Society of Physician Associates. I don't know exactly the equivalent for the UK. It would be the equivalent of the American Academy of PAs in the US.
Similar to the Faculty of Physician Associates?
Yes, I'd imagine that's very much so, yeah.
And the RCSI?
RCSI is the Royal College of Surgeons Ireland, which is the only college that hosts a PA program in the Republic of Ireland.
Brilliant, thank you. Just helpful to get our heads around some of these acronyms that we might pop up in the episode. Thank you. So in the UK, the first beginnings of the physician associate program can go back almost 20 years to when they brought some American PAs over into the NHS. But really, it's probably only in the last 7 or 8 years that PAs have really started to get established, and numbers of training courses have exploded, and number of PA graduates coming out into the workforce are really growing in the last sort of 5 years or so. How far back does the profession of physician associates go in Ireland, and how did it start?
So originally in Ireland, there was an interest in bringing the role to the HSE. And so they developed the pilot project back in 2015. Initially, that was based through RCSI and Beaumont Hospital, where a few American qualified physician associates worked within the hospital and RCSI to bring the role to Ireland. And they were working in different services. And I suppose the idea behind that as well was to bring the role to the Irish healthcare system to see how it would work, and to see how it would work with non-consultant hospital doctors, also known as junior doctors, and consultants, and to see would that be a feasible option going forward in Ireland to create a course around that. It worked well. We gathered data from that. And with that, then we had the establishment of the role and the course within RCSI. And I believe the first year of the course was in 2016. It was a small group at that time, which is understandable. It was the first year getting everything established. And we've just gone from strength to strength from that then. So now we have over 50 qualified PAs working in Ireland.
It's a similar pattern of development that I think developed in the UK. I know that you recently talked to Tamara Ritzma, who is currently at GW. She years ago had, with connections that she had in the clinical world, helped to bring the PA education model at least over to the UK. It's not that unlike what happened in Ireland. There are a number of consultant physicians in Ireland, in and around Dublin, that had trained in some capacity in the US, and in so doing, they were working with or alongside PAs over there. And when they returned to Ireland, they sort of realized that this is a missed opportunity, that there is really a need for this profession here. And so they're the ones who were instrumental in starting that process, like bringing the pilot program here, and with those first few PAs from the States that they brought in. And then it just sort of has grown from there. And they continue to be connected to the training schemes, the training programs for PAs, and this overall connection with the profession.
I've done a few episodes with physician associates from across the globe. So American PAs, PAs in New Zealand, PAs in the Netherlands. And it does all seem to be quite similar in a lot of the factors that drive the creation of the PA profession in these different countries. Mm-hmm. I guess in the NHS, it was perhaps a recognition of not having enough clinicians in the workforce and wanting to expand patient access to clinicians and have more people working in the medical model. Do you think it was similar pressures that drove that forward in Ireland? Yes,
I believe so. I think it's very similar to that of the NHS. Currently in the Irish healthcare setting, the government are working towards addressing future retention of junior doctors, NCHDs we call them, and improve their experience because they're under pressure, similar to that of the NHS, to retain staff, to have enough trained staff available for the jobs that are there at the moment. The PA role can really show its strength within the Irish healthcare system. So far, we've shown with different quality improvement projects, we can reduce wait lists, improve wait times for patients, improve all our services that we're on. So, and the healthcare, as I say, similar to the NHS, is under pressure. So we just hope to be involved in improving that now and in the future.
In terms of preparing students to become PAs in Ireland, one of the goals of the RCSI PA program is to actually bring in students who are dedicated to staying within the country and practicing as a PA in Ireland. So part of our requirements are that you are legally allowed to work in Ireland, but that it's also on an individual basis that candidates into the program are actively seeking ways to be part of the healthcare system in Ireland, because there is such a dearth of providers in almost every area, both geographically and in terms of the specialties and general practice. There is a tremendous need to bring in more providers. So that's certainly one of our goals, is to help treat that problem.
Yeah, absolutely. Sounds very familiar. Questions are popping into my mind around actual medical education and the provision of how you train PA students. Are there similarities? Are there differences in the university systems between Ireland and England? Funding for students, course length, those kind of things?
Sure. I think that you'll find at least the program at RCSI is very similar in terms of the overall scope and what they're trying to accomplish in terms of their graduates and their capacities to what is happening in the UK. And to some extent, it's similar to what it looks like in the US. Just keep in mind that the people who were originally brought over to build the program out came from the US, and they started off with that background as their design model, that they're using PA programs in the US to build that out. But I think over the years, although that hasn't been abandoned, we've really looked over to what's happening in the UK as the Faculty of Physician Associates puts out their guidelines, if you will, for how to regulate programs. And we've seen what it looks like to try to rein in the different ways of training PA students across the different schools in the UK. And that's becoming more standardized as best they can make that happen. We really do look to see how does that work for the FPA? How does that work for the UK PA profession? Because, it just makes more sense that the PAs in Ireland would be trained more in line with how they're trained in the UK. We still do OSCE testing within the program itself, but right now the certifying exam, which Aoife can speak to, doesn't currently use OSCEs as part of that board certification exam, simply because of the resources that it takes. I'm sure you're familiar with what the Faculty of Physician Associates goes through to try to pull off these OSCEs multiple times per year. It's a tremendous effort. And so we haven't quite gotten to that yet. And we are watching to see what happens with that in the UK, because in the US, they got rid of that a long time ago, simply because of the logistics of it and the cost. So we're sort of, in between those at the moment. But otherwise, it's a 2-year training postgraduate. Right now, it does help to have some degree of clinical experience going into the program, but it's not an absolute necessity. Having a level 8 health science degree is a requirement, because you do jump in from day one into some pretty advanced physiology, and having that background as an undergraduate student is very helpful. So really, I think if you get into the nitty gritty of it, it's quite similar to what you would see in the UK training model. And of course, the clinical placements, I would say the only difference between what we do in Ireland versus what the typical PA programs do in the US is that the clinical placements last a little bit longer. They're closer to 1.5 years versus 1 year of clinical placements in the US. So I don't know what sort of variation there is of that in the UK, but I would imagine it does kind of jump around a little bit from one program to the next.
Thank you, Sean. And Aoife, can you talk about sort of funding for PA's courses and university education? How competitive it is to get onto the PA course?
Well, it has become competitive now to secure a place on the Physician Associate course. In terms of funding, there's no exact funding there at the moment. It depends. There can be some funding from private hospitals, and that's on a consultant-to-consultant basis. And occasionally the hospital may foresee a role for a PA upon graduation, and they may fund a PA with that in mind. However, there's no definite funding each year. And of course, looking to the future, that would be something that would be incredible to offer to more students, to make the availability of the program more diverse, because our goal would be to train as many physician associates as we can and to make it available for as many people as we can, because as there's only one physician associate course masters in Ireland, and that's set in Dublin. And Dublin, like I'm sure is like the big cities in the UK, quite expensive to move if you're not from Dublin, to live there at the moment. So to make that more accessible, and we do have a new hybrid program where we're hoping that will reach out to more students, those who may not be able to move to Dublin, who may be living in other counties around Ireland, to make the program more accessible to them. That's not exactly funding towards it. However, certain consultants and hospitals can get behind that hybrid program, which we're hoping will make the course more accessible to more students.
Yeah, and if I can add on to that, the hybrid program, it's a challenge to build out a new curriculum like this, where we have 2 cohorts running simultaneously, and one will be in person, just as we always have done, but the other will be a collection of students who are scattered throughout the country. And so there is the logistics of it, which we will, figure out. We will still bring them on campus from time to time for in-person sessions, case studies, group sessions, physical exam labs, that sort of thing, as well as just having some touch points of, this is my class, these are the people I work with, just because we all saw what that was like during the pandemic, that it can be really beneficial to have some time physically in the same space together. But the benefit, really, as Aoife had mentioned, of the hybrid program is that we're trying to get students to stay in place where they are physically, where they're living now. So if we have someone who is interested in Galway on the far west side of the country, we want them to become a PA, but we want them to go back to Galway and really participate in the healthcare system there where it's really needed. Because what we find, and this is not unique to the situation in Dublin, I'm sure it happens in all sorts of places in the UK, and it certainly happens in the US, where bigger cities tend to be where the universities and colleges are located. Students will move to those locations to do their training, and they make all their connections in that location. And that's where they start building a network for that first job as a PA and thereafter. And so what you find is that they're not moving back to their hometowns. And there are all sorts of initiatives to try to change this that I've seen over the years. And I think that the hybrid approach that we're going to take next year, where some of our students will be located in more remote parts of the country, it's with the goal to not only make it financially easier for some students so that they don't have to live in Dublin, but also that they stay where they grew up or where they've worked and went to college and have a network already established. And there is a tremendous need for, a GP in Donegal, where there may not be any PAs right now. So that's really the long-term goal with that.
But yeah, recognizing that, otherwise, it's very difficult to recruit.
Yeah, so you can understand that.
It's really interesting to hear a lot of the similarities between the two countries. I wonder if there were particular challenges being one of the first PAs to train and to work. Have you found it a difficult process? Has there been pushback? Have you had things that you've had to overcome as PAs?
But to be honest, as a student, I wondered when we went out on placement, would we be completely separated from the medical students? Would we be seen any differently on our placements? And I have to say, I've never experienced that. We wanted to get involved as much as we could, and we wanted to learn as much as we could. So we attended the same 7 a.m. start for ward round like the medical students. We stayed till they told us to go home. And we made the most of our placements because we are on, the 24 months course. We wanted to get as much as we could out of every placement that we were on. So we stayed there till the end. We asked for extra lectures teaching from some of the junior doctors when we were out on our placements. So I personally didn't experience any sort of pushback as a student. And then graduating, I wondered again, the hospital I'm in, the Mater Hospital, I was only the second physician associate to work in that hospital. I have a fantastic physician associate who started the year ahead of me, Maria Mackin, and she's the previous president of ISPA, and she was fantastic in bringing the role to the hospital. So it was wonderful to have already had somebody establish it there. Within my own service, I was the first physician associate on the breast team. I would sort of mix my time between being in surgery and in clinic. And for most people around me, I would have been the first physician associate for them to meet and to work with. And the first few months, I worked hard, tried to build my role. I thought that there'd be more pushback than there was. But people were all very friendly, very, very helpful, very kind. All the junior doctors I worked with were more than happy to teach me what they knew and to get me up and running. So whether I've just been very lucky, I just find that I've been in a good position there, and just work hard and show what we know. And I feel like that stands through for me. Anyways, I found that so far.
Brilliant. Would you say, I hate the phrase brand recognition, but would you say there is brand recognition of PAs amongst your colleagues? Is it growing? Do patients know what PAs are?
Well, that's it. I find that any patient I see in clinic, I'll say, hello, my name is Aoife. I'm a physician associate working with the team. And sometimes they notice it and they say, oh, what's that? But more times than none, they're just more than happy just to be seen and looked after. And I've never had any issues around that role in describing my role. And I do find that now with having a second physician associate on our team, and there is another physician associate and she's starting in trauma in our hospital, I find that there's more awareness of our role, and that does help. It definitely does help. I hope for those who come after us, it'll be just that little bit easier, and that people will know for sure this is what you do and this is what you can do. And not that we've ever been underestimated, but it may be just before you are undergoing a procedure or whatever it is that they want you to do, and then are you able to do this? And there'd be hopefully less of that. It'd be like, oh, I know your colleague is doing this on that other service, and so on. So I definitely think the more that are out, the more helpful it'll be for those coming behind us.
Where I'm coming from in the States, I used to always encourage the students who were finishing at the program at GW or the Mass College of Pharmacy and Health Sciences, where I was on faculty, as best they can, try to seek out jobs where there has been a PA there before them, because it does make for an easier career, beginning your career or transition into your career coming right out of school. But that is in a country that now has over 100,000 PAs. And Aoife, correct me if I'm wrong, but there are about 50 in Ireland. And so that's not an option here, right? And I can't tell the students who are leaving the PA program at RCSI to, if they can filter out the jobs that have a little bit of experience with PAs. So there is definitely an extra challenge for the graduates from this program, but we just try to encourage them to watch out for things that might become places where you get trapped later, where you're kind of stuck not knowing what should I do in this situation where my consultant doesn't understand what I'm doing, or doesn't allowing me to have full practice ability based on what my training is. So far, the little bit of experience that I have in the time that I've been here, I've been very impressed with how the students who are leaving the program are jumping into positions that they are absolutely welcomed. That's for sure. That the consultants that are bringing them on and the healthcare systems that are bringing them on are really eager to have them there and are doing what they can to make it a good work environment for the PA, and really trying to understand what the profession is about to just make the entire delivery of healthcare better. So that's great. And I hope that continues. But it would be nice, in a few years, that we could start telling our new graduates that, oh, well, this hospital system has 15 PAs at it. That's something worth considering as you weighing the pros and cons for the different offers that you have on as you're graduating and becoming a PA.
Yeah, absolutely. Sometimes I was one of the first to train in my region, and having to explain the role ad infinitum for the first few years, it got tedious.
Absolutely. Yeah.
It is getting better. I'm 6 years down the line now, and there's certainly more understanding of the role and recognition of the role. So, Are job prospects good for PAs who train in Ireland? Is there good demand for PA jobs? Is supply not meeting demand? What's it like?
Definitely. I feel like all PAs who have graduated have gone into employment, and there's more jobs that are available are yet to be filled. So there's definitely enough jobs for the PAs. It's just not enough PAs for the jobs. So that's why we need to keep training all our new physician associates, and just throughout, even just working in the hospital I'm working in, consultants will hear of your role and express their interest in how they can go about getting a physician associate for their team. So that's always really encouraging to hear.
Now, I can't believe we've got all the way through the episode so far, and we haven't even talked about prescribing. It's often one of the barriers that comes up in the UK for people not wanting to employ a physician associate, or thinking that it won't work because we can't prescribe. That's because at the moment we're not a regulated profession, although we will become regulated by the General Medical Council, the same body that regulates doctors in the UK. And then at some point, it's hoped that once we're regulated, the conversation around prescribing will then come down the track. What are things like in Ireland? Are you a regulated profession? Who will regulate you? Can you prescribe?
So we are very similar to the UK in that our goal, our priority would be to work towards regulation of the profession. And similar to UK physician associates, I feel like once we are regulated, we'll be able to work to the full strength of all our knowledge of what we know, what we can bring to a team. I'm really hopeful that we are working towards that as you are in the UK. And hopeful that this will happen in the near future, working with the government, and then hopefully we'll have a body that will take us on to regulate us. It's so important for our role down the line that we will be able to prescribe, that, you know, at some point we'll be able to order ionizing radiation, because I feel like this will allow us to work to our full potential, as I know is the same with all UK physician associates, and definitely look to the US physician associates and to see how established it is there to, you know, keep the hope that it will happen in the future, working towards that.
Fingers crossed soon across the board, eh? With regulation might also come then the possibility of working abroad, or physician associates moving from where they've trained to the States, or perhaps UK trained PAs going to work in Ireland or vice versa. Mm-hmm. Do you see that potential in the future?
I mean, definitely. I mean, it'd be fantastic. It'd be great for US, UK, Irish PAs and PAs from all over the world to be able to work in other countries. And if they come back to their own after, that they can bring all that knowledge that they've learned and bring that back as well, especially between UK and US, especially the US, with having such an established role of the physician associate. I'm sure we'd have a lot to learn going over, even if it was for 6 months or a year, and bring it back to a service. It'd be incredible. It just would open even more opportunities, and I hope that we'd have that in the future as well.
And I think you can correct me if I'm wrong, Aoife, but the way that the current system is set up, if you are a PA that has passed your board exam either in the US or in the UK, you are permitted to take the IPAN, which is the certification exam here in Ireland, and work as a PA. The reverse is not necessarily true. So we do know that PAs graduating from RCSI who have passed the IPAN will not necessarily, at this time, they're not able to take the PANTS in the US. And the same is true for the UK test currently. But there are discussions, we'll just say murmurs more than anything else, of will there eventually be some level of reciprocity? It's really early to actually even predict where that will go, but there's a lot of interest in it. So right now, we haven't really seen anything with that. But as Aoife had mentioned, there's more jobs than there are PAs. And so it is not unheard of for folks who have finished their training and taken the test in the UK to then apply to take the IPAN in Ireland and work. You would, need to otherwise be able to work in Ireland legally, but other than that, it's just a matter of passing the exam.
Brilliant. Thank you, guys. I found it really fascinating to find out about how physician associates have developed and evolved in Ireland over the last few years. Turning to the future, what do you think the future holds for physician associates in Ireland?
I think the future for physician associates will be regulation based. So once we have our regulation, I feel then we can work to our full scope of practice and fully contribute everything that we have learned to our given service and team. And I think that is the goal going forward, that we can get that regulation and to work to our full capability. That is what I hope for all physician associates going forward, and to keep driving towards that, just so that all our hard work and that course, the tough days in the course and the tough placements and all the hard work we're putting out as graduates, that we really get to work to our full scope practice after regulation, as similar, as I say again, to how you've pushed along with the UK regulation of physician associates. We aim to do exactly the same. That's what I hope. And I hope that all qualified physician associates, when regulated as well, be able to fully contribute everything that we know to our teams. That's what I hope in the future for physician associates.
And I think with more regulation, more acceptance of the profession will come. And my experience has been when that occurs, then you start to see exponential growth, or at least exponential interest in getting into the training programs, PA programs. So not only will there be more students coming through RCSI, but I do think you'll probably see more programs open up, probably in some connection to the medical training programs that already exist in Ireland. And it really just takes a matter of a couple of years to kind of really explode in the growth once you have a greater acceptance of the role of the PA in the healthcare system in Ireland. And that really just translates to more regulations and reimbursement payment and those sorts of things.
Well, that's brilliant, isn't it? The future, I think, is exciting for physician associates across the world, really, in lots of different countries. It's growing as a profession.
Absolutely.
Thank you so much for joining me on the podcast. It may have sparked off ideas in listeners' heads. They may have questions that they want to find out more about. Where's the best place to go to find out more information about physician associates in Ireland?
We have the Irish Society of Physician Associates, known as ISPA. We have our website. It's quite easy to find. Just Google ISPA. And we have a link there and an email. Please feel free to send us any of your questions, and we'll hope to get back to you as soon as we can. And
in terms of PA education in Ireland, I would definitely recommend going to the Royal College of Surgeons Ireland website. That's rcsi.ie. And you can easily find the physician associate program information there. There is a Twitter handle, RCSI_PA studies, that is pretty frequently used by various members of the program. So that's another good place to go to as well.
Brilliant. Thank you. I'll leave links to the ISPA website and the Royal College Surgeons Ireland website and Twitter handle in the show notes, so people can look on their device and find how to get in touch through there. Thank you so much for joining me on the podcast. I found it really interesting to find out more about physician associates in other countries. Like I say, I'll leave the contact details that Aoife and Sean have spoken about in the episode notes, so you can look for them there. And I hope you'll join me again for the next episode.
Thanks for listening to the Physician Associate Podcast.